The seed for NRF was sown several years ago by Dr. Pratap C. Reddy, chairman of the Apollo Hospitals Group. While on ward rounds, Dr. Reddy continually stressed on touching 1 billion lives with care and compassion. I observed that recovery of patients with neurological deficits was really the slowest. The spark for neuro rehabilitation was born then.
So when you look at the mission, our primary mission will remain the maximum recovery that's possible from any kind of either a birth defect or an injury or an illness which has led to the current state of things. So with physiotherapy and planned therapy of other kinds, we make sure that whatever recovery is possible under the circumstances, we are able to reach that level.
Basically, internal medicine offers a holistic approach. Majority of the stroke patients either have coronary artery disease, diabetes, or high blood pressure, so multiple medical problems, or peripheral vascular disease. So that is where during the acute phase, in association with neurologists, we take care of all the acute medical problems. Once the acute phase is over, that is where the internal medicine role becomes bigger, because that is where rehabilitation starts.
Occupational therapy equips a person with disability or those who are at risk of disability with skills that empower him or her to become functionally independent at home, school, or at work. We take pride at NRF for our ethical and scientific practices.
NRF wants to renew the hope in the patient that they will get back. The cells, their brain cells will revive, and that they will restore their function and they will restore their normal lives.
Developmental disorders are a group of conditions where the child does not develop according to his or her age, either physically or mentally. The delay could either be in mental abilities, motor activities, speech and communication, or social behaviors.
Professional counseling involves listening to an individual, couple, or a family which might be facing problems in their personal as well as professional life. We at NRF give a very highly subsidized sessions to the people who are vulnerable to depression, anxiety, or psychological concerns due to various circumstances which they might be having in their life. We also do online consultations for the clients who are hesitant to travel to the clinic or want to keep their identities discreet.
Speech therapy tends to form the core of rehabilitation. At NRF, we help address all your concerns by providing consultation, screening, diagnosis to treatment, management, and counseling for various disorders. Disorders like autism, ADHD, stuttering, misarticulation, cerebral palsy, language delays, voice or resonance disorders, learning disabilities, aphasia, and various other stroke or neurological disorders.
These are patients who can completely change their lives with rehab. These are people who primarily have cognitive disorders, they have incoordination, they have strength issues, they have so many complex things.
To ensure that for the most minimum possible cost, without compromising on quality, we achieve the best results. When communities come together, individuals or organizations who are able to support these causes, when they come together, the outcomes can be brilliant.
I have been involved in running charitable activities through various trusts from a very young age. I run an old age home, an orphanage, a vocational training center, and 2 schools under a CSR platform, one in Delhi and one in Jaipur. We all know what wonderful work NRF is doing. And through this medium, I would like to appeal to all of you to donate generously to this cause. Our aim is to bring 100,000 smiles through 100,000 therapy sessions a year.
My son Atharv, he has a speech delay. I found about NRF. The staff over here is very friendly. They have all kinds of therapists and instructors. They evaluated him and they recommended us therapies that we should go for. The changes that we are seeing in our child are good, they're positive, and we have seen phenomenal change in him since he started taking the therapies. So it's super affordable. Looking at my child's development so far, I would recommend NRF to everybody.
मैं सुनीता यहाँ हाथ में बहुत दर्द था, 10 दिन आई हूँ। मेरे हाथ में ये बहुत आराम है। सूती सूती का एकदम दर्द उठा करता, मैं रोने लग जाया करती। यहाँ आई तो मेरा बहुत आराम है। मेरे को ये कोहनी में दर्द था, खोए में दर्द था, गर्दन में दर्द था। मेरा ये 4-5 महीने आता था। मेरे को 10 दिन हुए हैं। गर्दन का तो बिल्कुल भी दर्द नहीं है, मेरा बस थोड़ा बहुत खोए में और कोहनी में रह रहा है।
मेरा नाम है तेजपाल यादव, दिल्ली व्हीलचेयर क्रिकेट का वाइस कैप्टन। जब हम स्पोर्ट्स में खेलते हैं रेगुलर, तो कई बार हमारे शोल्डर में व्हीलचेयर चलाने से शोल्डर और गर्दन में काफ़ी पेन होता है। उस वजह से हमें रात को नींद भी नहीं आती और अपना बेस्ट भी नहीं दे पाते। तो फिजियोथेरेपी कराने से हमारे को रिलीफ मिला है और पेन भी कम होता है। हम आराम से लेट भी जाते हैं। पहले लेटने में भी दिक्कत आती थी कई दिन तक। इससे हमें काफ़ी 80% रिलैक्स है और आराम भी है, पेन भी कम है। बाकी खेलते समय भी हमारे को काफ़ी रिलीफ मिलता है।
I have a by birth congenital disease which resulted in locomotive disability and restricted motor skills. I've been taking physiotherapy sessions at NRF. It's been 6 months and I've seen a quite difference in terms of my flexibility and more independent manner. Also, I've recently started taking this speech and occupational therapy.